reason we got involved in this study was really through my contact on numerous occasions of being at a wound care conference where my talk around palliative wound care more generally was preceded or followed by one of the specialist nurses for epidermolysis bullosa talking about the real problems they had in applying wound dressings to very extensive areas of broken skin. And I got to know the nurses very well, and one day we decided we must do something about this, and we started the research project with funding from the charitable foundation, the main hospital in London where these patients are cared for. And the first step we took was to have a workshop or a series of workshops with the patients themselves and their carers, and we asked them the simple question, what would make a difference? And they all came back saying to us, give us an alternative to the flat and the tubular bandages we have to put ourselves into every day. And that's what we did. We pulled together a team with a fashion designer to help us to put a clothing concept onto clothing the wounded body, if you like, as opposed to covering a single wound, which is what happens at the moment. And we found this knitwear company who've got computerized machinery and were willing to work with us to do this iterative development of the garments with the patient group. Currently, the industry that supplies wound care products to patients, they provide pre-sized, pre-shaped dressings, so 10 by 10 centimetres, 10 by 15 centimetres, which is fine if you've got a single wound that fits within that dimension. But when you've got pretty well whole body wounds, the only recourse you've got is to patchwork multiple dressings in order to cover an extensive area. And the dressings are taped together. You can't put tape onto people with epidermolysis onto their skin because it's so fragile that it will rip. So the dressings are taped together, and then until we made the garment range, they would wrap flat bandages around those dressings and then put extra padding and a tubular bandage on top in order to keep the dressing stable and in place. But that system is actually not stable, and the dressings tend to drift apart with typical movements during the course of a day. And increasingly the patients will be subjected to their wound fluid escaping, soiling their clothes, but more importantly they can end up being stuck to their clothes. And at night they just have to get into the bath and soak everything off, which is a really awful experience. And this is very costly to do. I mean, each single dressing or each individual bandage may cost a few pounds, but by the time you've multiplied this up to 40 or 50 dressings, plus 10 or 12 bandages on a day-to-day basis, and everything's been cut off and put into the waste, you can see it does mount up to being a very expensive process. So we're working on the clothing concept in order to get something that clothes, as I said before, this wounded body, as opposed to trying to cover a single patch of a wound.